Almost everyone has that one friend who never leaves home without an acidity tablet. Burning in the chest after biryani, sour taste in the mouth at night, bloated stomach after every meal. So they pop an antacid, feel better for a while, and repeat this cycle for months or even years. But here's the scary part. Most people have no idea what these acidity and gas medicines actually do, when they are okay for quick relief, and when they are a big red warning sign that your body needs a doctor, not just another tablet. So in this video, let's break down acidity, gas, and indigestion medicines in a simple, practical way, so you can respect your stomach instead of just silencing it. I'm Ammar, a licensed pharmacist, and this is Medicine Wise. If you want clear explanations about the medicines you already use at home, hit subscribe and let's start. First, let's understand what people call acidity. Common symptoms are burning in the chest or upper stomach, heartburn, sour or bitter fluid coming into the throat, reflux, heaviness, early fullness, burping, bloating, or gas. These can come from many causes: heavy meals, spicy food, coffee, stress, late night eating, lying down soon after meals, smoking, some medicines, and sometimes from deeper problems inside the stomach or esophagus. At the pharmacy, you usually see three main groups of products. Number 1, antacids. Number 2, gas and bloating products. Number 3, stronger acid reducers. In some countries, H2 blockers and PPIs are over the counter. Let's start with antacids. Antacids are the classic chewable tablets or liquids that neutralize stomach acid directly. They work fast, often in a few minutes, but they are short-acting. They're good for occasional heartburn after a heavy or late meal, mild, short-lived acidity with clear triggers. They're not designed for daily, all-day, everyday use for months, covering up serious pain or bleeding. Some antacids may cause constipation or diarrhea depending on the ingredients, and some contain a lot of sodium, which is not ideal for people with high blood pressure or heart issues. Next, let's look at gas and bloating products. On this shelf, you'll often see products with simethicone or similar ingredients to break gas bubbles, herbal or enzyme combinations to help digestion. These can help with that uncomfortable, bloated, gassy feeling after eating too fast, too much, or too heavy. But again, if you have pain, weight loss, vomiting, or long-term issues, gas tablets are not a solution. They're just a bandage. Now we move to the stronger acid reducers. Depending on your country, you might see H2 blockers. They reduce acid production for several hours. Proton pump inhibitors, the strongest group for acid reduction, used once daily in many conditions. These can be very helpful in conditions like reflux disease, ulcers, or severe acid problems when used under proper medical guidance. But here is where things become dangerous. Many people start a PPI or other strong acid blocker for a few days, feel amazing, and then stay on it for months or years without ever asking why their body needs constant acid shutdown. Long-term, unnecessary use of strong acid blockers can be linked to reduced absorption of some vitamins and minerals, higher risk of certain infections, masking the symptoms of serious disease. So here is a simple rule. If you need a strong acid-blocking tablet most days for more than a few weeks, your stomach is sending you a message. Don't just increase the dose, investigate the cause. Now, let's talk about red flag symptoms. Situations where self-treating acidity is not safe. Unintentional weight loss, difficulty swallowing or feeling that food gets stuck, vomiting blood or vomit that looks like coffee grounds, black tarry stools, which can be digested blood, severe constant upper stomach pain, chest pain that could be coming from the heart. If any of these are present, this is not just gas or acidity. This is a doctor now situation, not a chew 2 more tablets and sleep situation. Now let's clear up a common confusion: chest pain, heart versus acidity. Acidic burning can sometimes feel like chest discomfort, especially when lying down after big meals. But heart-related chest pain can also feel like pressure, tightness, burning, or heavy weight, especially if it comes with shortness of breath, sweating, nausea, or pain going to the arm, shoulder, or jaw. If you ever feel unsure whether it's your heart or your acidity, don't test it at home with antacids. Get proper emergency help. Your heart doesn't care if you're too young or too busy. Now, what can you do beyond tablets? Medicines help, but lifestyle can double their benefit. Avoid very heavy, spicy, or oily meals late at night. Don't lie down flat immediately after eating. Wait at least 2 to 3 hours. Reduce smoking and alcohol. They weaken the valve between stomach and esophagus. Eat a bit slower, chew properly. Smaller, more frequent meals are often better than giant plates twice a day. Losing extra weight around the belly can significantly reduce reflux for many people. Think of medicines as tools, not as permission to keep abusing your stomach. Now, some real-life mistakes I see often as a pharmacist. Mistake 1, using antacids like mouth fresheners after every single snack every day. If you need them so frequently, you don't need a mint. You need a checkup. Mistake 2, ignoring black stools or vomiting blood because I took an antacid and it went away. These are not symptoms you bargain with. They're signals to get urgent help. Mistake 3, self-starting a strong acid blocker from a friend's leftover pack and never stopping it, without ever asking a doctor why the acidity was so bad in the first place. You deserve more than a life where your best friend is a strip of antacids. So, to summarize your SMART rules for acidity, gas, and indigestion: antacids. Okay for occasional, mild, short-lived problems. Not a daily long-term trick. Gas and bloating pills can relieve discomfort, but if pain or symptoms are frequent or severe, look deeper. Stronger acid blockers. Very useful when truly needed, but long-term use should always involve a doctor and a clear diagnosis. Respect red flags: weight loss, difficulty swallowing, vomiting blood, black stools, severe pain. Do not self-treat these. Support your medicines with smart eating habits, meal timing, and lifestyle changes. Your stomach is not your enemy. It's just trying to tell you when something is wrong. If this helped you understand your acidity and gas medicines better, subscribe to Medicine Wise by Ammar for more clear, practical videos on everyday medicines and how to use them safely. For more clear medicine and nutrition tips, subscribe to Medicine Wise by Ammar. This is general education only. Always consult your own doctor or dietitian before changing your diet or medicines.